Okay, 32-year-old woman, Gravata 2 Para 1. She has a history of RA controlled with methotrexate, and the baby is going to be at risk for what? That's pretty much all that there is to this question. It's neural tube defects because of the inhibition of folate. Excuse me, I don't know what that was. Methotrexate is a folate acid antagonist, which increases the risk of these defects because anytime you got a tissue that is just replicating and requires a lot of that DNA transcription, methotrexate is going to mess it up, especially in embryonic development. So methotrexate competitively, I'm doing it again, competitively inhibits dihydrofolate reductase, which blocks the conversion of DHF to THF. THF is needed for DNA synthesis. And so if you don't have it, then how are you going to make your neural tube and your stem cells? And that's the reason why the answer is neural tube defects, because if you don't have this crucial THF, then what are you doing? How can you create those cells? So inadequate folate leads to improper neural tube closure, and anencephaly, spina bifida, that's like on the backside. Myelomeningeal seal is like posterior, anencephaly like anterior. Other congenital defects associated with this: cardiovascular abnormalities, urinary tract abnormalities, and skeletal abnormalities. So folic acid supplementation should be given 1 month before conception. And let's talk about the brachial arc abnormalities. That'd be vitamin A teratogens. And so like if you have Accutane, it might disrupt these Hox signaling mechanisms which cause these defects here. Renal dysplasia, ACE inhibitors like lisinopril, these ACE inhibitors ending in prils cause renal dysplasia, olihydramnios. So you can see that stuff. Sacral agenesis, maternal diabetes, caudal regression syndrome would be associated with that. Skeletal abnormalities, I gotta drink a glass of water of those. Syphilis causing periostitis and osteochondritis. And so methotrexate can affect the bone growth, but does not cause inflammatory skeletal lesions. And thyroid hypoplasia. So radioactive iodine therapy for hyperthyroidism, can cause fetal thyroid agenesis and hypoplasia. All right, so basically, methotrexate, folate, and then folate makes you think of neural tube defects because of that DNA synthesis, which is needed. So hopefully that was helpful. If it was, go ahead and like and subscribe. For every person that likes, I will drink 1 glass of water.